in general. It's just a passion, that's all. Hey guys, welcome back to my channel. It's Pauline. If this is your first time clicking in, thank you for watching this video. I appreciate you clicking into the thumbs up button and subscribe if you're not subscribed. It will be much appreciated. So this video today, we're going to be talking about working in the hospital during coronavirus. I am a nurse and I do work in a cardiac step-down floor. The cardiac step-down floor that I work in has been transformed to a ICU coronavirus floor. Yes. So currently in the hospital systems around the world, a lot of the hospital floors have been converted into ICU floors or coronavirus floors, because the ICU has only 20 to 25, unless it's a very, very large unit, beds per unit. And there is not enough room for the amount of patients that are coming into the hospital at one given time. So a lot of the regular hospital floors are being converted into negative pressure rooms, into ICU floors. Yes. So if you are not an ICU nurse and you are working on a different floor, and your floor is probably going to be converted into an ICU. Our floor particularly is 21 beds. One half of the hall, like room 1 through 10, is just our regular COVID rooms. Could be possibly COVID positive patients in those rooms. And then beds 12 to 20 are COVID positive ICU beds. Usually 15 to 20 are ICU, like bad. They are in a bad place. They are deteriorating. They are intubated, and the ICU nurse has to take care of them. We do not take care of those patients. The ICU nurses come from the ICU units and they take care of those patients on our floor. So it is a traumatic experience to see those kind of patients on our floor because they are intubated. I have experience of working on an ICU as a patient care tech, so I have seen intubated patients before that are sedated, or patients that are non-responsive. But these patients, it's just something different about them, because you know the situation. You know that it's something that, you know, they did not do to themselves. It's not like it's diabetes, high blood pressure, and they just did not take care of their body. They just have contracted this very deadly virus that is killing them, killing everyone. You know, it is rough coming to work and having to see this. Not what you want to see when you come to work. Not at all. It is so hard to do this every day. It's rough to have to do this, you know, and it's hard, but it's, you know, it's a passion that we nurses, doctors, hospital workers have to care and take care of those that are sick. It is a passion that we have, and this is why we come and do this every day that we're scheduled. I'm filming this today. I have to work tonight. It is a Friday. So I will be going in tonight and tomorrow, Saturday night. So 2 nights in a row. I like to do it like that because 3 nights may be a little overwhelming, especially for how heavy our floor is. So typically a night shift for me would be 3 patients. Normally, well, there has been 2 COVID positive patients and 1 that is not COVID, is what we've been having assigned lately. So yeah, just been trying to deal with that. I have not been fit tested at this new facility, so I do not have an N95 to wear. I have to wear a PAPR. The PAPR does make me feel a little bit more protected, but it is a lot to have to put on when you have to go into a room. But it is fine with me. I do appreciate them having that, since they do not want to fit test me. And the reason they won't fit test me is because they don't want to waste any mask. But, you know, it is what it is. I just put on the PAPR and be grateful that I get to put the hood on my head and I get to hook it up to oxygen, and then it runs for me. So I'm grateful for that. And what we're doing is we're going into the rooms, and we are, you know, as a night shift nurse, if you already know, there are times that we have things scheduled. It's not as often as the day shift would be, But meds are usually passed at 9 p.m. If patients are on Q4 sugar checks, they have Q4 vitals. We have them hooked up to step-down monitors, so we do not have to go into the room. Often we can set the machines to have the vitals taken. The only thing that we would have to check is temperature, and we would do that when we go into the room. It is, very interesting how people are managing the care. Some patients, some nurses, I understand people don't want to go into the rooms, The goal is to limit your exposure. So we don't go in the room as much as we may want to go, We try to call into the room first. The rooms are set up with iPad cameras. So we are able to view the inside of the room from the outside with our, on our computer. So we'll be able to see the patients and ask them questions, talk with them by phone, all of that. To make sure that when we're coming in there, we're using our time wisely, we're taking what we need into the room, we're clustering care, so we do not have to keep continuously exposing ourselves to coronavirus. These patients have been tested and have been tested positive. So they're gonna stay in the hospital until their symptoms are managed. If we have patients that are having trouble with their breathing, we make sure we try to get them to a point to where they are not oxygen dependent. We make sure that their infection is gone. The main thing that this virus is causing is pneumonia. It's attacking those lungs. So we make sure that they are on antibiotics. We make sure that their white blood cell count is decreasing. We make sure that patients' oxygen levels are above 95, 98. Without oxygen, we make sure patients can ambulate without shortness of breath. We maintain cough. An inpatient can be sent home even though they are still probably positive for coronavirus. They do send patients home. They have sent patients home without even getting results from their coronavirus testing, because initially when this all started, it was taking so long to get results. They were saying it was gonna be like 6 to 10 days to get results. So it was like so long to get coronavirus testing results. Patients were just staying in the hospital, and it was just too much, guys. It was just too much. I mean, it is just a sad, 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 sad situation, It's sad. So when we come into the hospital, the first thing we do is we walk in through the doors. They have a table where they give us a mask. Thank you.
Have a good one.
You too. And we're asked to wear a mask our whole shift. We have to have a mask on. It does become overwhelming. Sometimes I have to take the mask down, but it's just hard to just breathe in through the mask all day. The patients are young. The patients are all ages. The patients are not older patients. Some of them are. The patients are not, always elderly. I know they said that the patients are elderly, but that may not very well be the case. I've had a 29-year-old with coronavirus, 30-year-old, 42. It's not always a 70, 80-year-old. We do have those as well, but, I had a 95-year-old. It was sad. Some of these patients are from nursing homes. So it's going through the nursing homes. It is spreading through the nursing homes. We had a patient from a prison one time, but he was negative, I believe. We had, I don't know, we've had so many different patients. Oh my God. We've had all kinds of patients, all kind of walks, all kind of races. It's no discrimination. Coronavirus will hurt whoever it wants to hurt. Yeah. So on our floor, we try to keep everything disinfected. We wipe all of our work areas off as often as we can. We try to wash our hands as often as we can. It's a corporate effort for everybody to be safe. We come into work, we get an extra change of clothes. We don't have to wear the same clothes that we come to work in. So I don't go to work in my work uniform. I go to work in regular clothes, street clothes. I usually wear like some joggers and maybe a t-shirt or some leggings or something. And then I just go and change when I get to work. I get a uniform from them. And I change my clothes in the bathroom, and then I go to work with those clothes on. I get a head covering where I cover my head. I have my mask on, and then I cover my shoes with shoe covers. So I'm pretty covered throughout the shift. When I go into a patient's room, we do put a gown on, and then I have my PAPR on, which I leave my mask on under my PAPR, even though they say I don't have to, but I don't take that chance. The respiratory techs, I think that's what they're called. I see them go in with the mask and the PAPR, so I'm gonna do the same thing. So I have my PAPR on, and then I have my mask underneath it. So I'm covered, but I'm still breathing in the air that they give me. I just feel more protected that way. Yeah. And you have to do what you have to do to make yourself safe. You have to be safe when you're out here. You cannot just do nothing. You know, you got to be safe. You have to be cautious of your surroundings. You have to limit your exposure to other people. You want to make sure that you're not close all up on somebody's face. You know, you want to make sure that you are away from them. You know, you want to make sure that you're doing your 6 feet and you're washing your hands when you're out in public. It's so limited in the amount of, we can't get any sanitizer here where I am. Everything is so limited, it's scary. Like, we've got toilet tissue, which I gotta go get some more, but we don't have sanitizer. We don't have like Clorox, like bleach wipes or disinfecting wipes. Like, we don't have anything here. So it's like, okay, what do we use? What do we use to clean our area? You know, I did get some cleanser. I did get some other cleansers, but cleaning supplies and cleansers are very hard to come by here. It's just a different situation. You know, we've never been in this situation before. And this pandemic is just a mess. This pandemic is just hard for everyone, and it's definitely hard for us. And I just want to encourage all of you to be safe. I don't think I have anything else to say about this whole working in the hospital. If you guys have any questions about this working in the hospital, let me know. I mean, but you know, we just trying to protect ourselves. You know, it's hard and things have changed. Everything has changed. When I first came here, I was on orientation. I'm not on orientation no more. I'm on my own, quicker than they probably would have wanted me to be. But with this situation, what else am I learning? Nothing. I finished my critical care fellowship, so I am now a critical care nurse, which I'm excited about that. That adds something else to my resume, which I will add, that I finished my critical care fellowship.